I'm John Fleming. I'm a police inspector with Police Scotland. I'm working in West Lothian. My grandiose title is Deputy Local Area Commander for West Lothian, but real, I would say, is Community Inspector is what I like to class myself as, so we'll go for that. Between January and November 2024, involving young people under 16, where we have recorded a marker for alcohol. So for 0 to 11-year-olds, we had 196 incidents between January and November 24, and for 12 to 17-year-olds, it was 265 incidents. That's 461 in total for alcohol over an 11-month period. And in the same age groups for drugs, it was a 0 to 11 was 99 calls, and for 12 to 17 there was 142 calls that had a drug marker, so it's 241 calls in total for 0 to 17-year-olds from January to November 24. The basis of that is that we get roughly 140 calls per day. So if you do the maths, that's a very small number of aggravating factors for drug or alcohol. But that's not to say there haven't been a number of other calls where it's been a factor. It's just not been recorded. The care of the individual is always put first. It doesn't matter what the incident roundabout that is. That's our primary factor, preservation of life and property being policed. So we've got to make sure that the person, individual's well catered for. However, unfortunately, a lot of time when it comes to alcohol specifically, there can be an increase in violence. And we're also seeing what we call ABD incidents, where people have got polydrug misuse, they have alcohol misuse, and that always a factor leads to increased issues for us as police officers when there's increased violence, and it's not the individual's fault, but it's very, very difficult for us to deal with. So we've got to consider a number of factors around that. So there's a rise in violence, the welfare of the individual, welfare of my officers as a leader within Police Scotland. I've got to consider that as well, that I've got appropriate amount of resources going to an incident when we have challenges in that relation. And then we've got changing drug and alcohol patterns as well. So yeah, we've got to be conscious of the changes in public use as well. But I think one thing I've said over the 29 years is definitely the willingness of the police to work with partners to ensure that we get the best care and welfare for individuals. Because charging somebody with a criminal offence isn't going to change behaviour. So what we've got to be important is working with third sector and our partners to try and open people's minds to it and maybe change behaviour. We've obviously got the West Lothian Addiction Care Partnership Services card, so but that's out there. So my community and response officers have access to that, and we can signpost at source when we're dealing with people, and we can advise families as well. If a member of the public phones into the service centre, old money control room, but now it's a service centre. When they phone in, we can signpost people to relevant services based on what they're telling us over the telephone. So sometimes a call might come into the police that's a health matter, so we'll signpost it to the appropriate measure. So I think there's always room for improvement, but I think we're getting there and we're doing the right thing for signposting, and that's an improvement, I think, over the years as well. So at this moment in time, I presently have 3 school link officers. They're called campus officers. These officers work within certain schools within West Lothian that they're funded officers, and their role is to supplement education services with specific police biased interviews on certain things. So just now we carry out inputs covering the local drug trends, legislation, search powers, dangers of drugs, and we're doing the online high resource and cover inputs, and we cover county lines as well when we do our input. So we touch on more the policey side of substance misuse. So young people are educated and understand our role within it as well. If they're found in possession, so they understand what we do and their rights as well, because it's important for young people to know their rights. When found in possession of drugs, when you're over 16 or over, it's a criminal offence. That's it. It depends on what the person's in possession of. So if we go to under 16 and above the age of criminal responsibility, you will be charged with an offence. But the important thing of that is we do what we call a VPD, we raise it with social services, social work, we share it with our partners, and it's a health matter then. We can work as an organisation, as partners, to try and see what we can do to help that person. But on understanding that they still have committed an offence. As they get older, it then becomes criminal offence as well. So 16 or over, it can become a criminal offence, and they will be dealt with as. And so again, it's all whether they be arrested or not. Not everybody gets arrested, it's found in possession. Some people, it depends on a number of factors. But the long story short, and the thing that people have to understand is that the risk of having a criminal charge or a criminal conviction against you when it comes to drugs for your future of going on holidays to America and things like that, we try and educate in schools about that as well. Every year, police officers have to do a recertification for their officer safety, and part of that officer safety is a first aid course. So we get further advice and further training on that as well. So I would hope that we're much better skilled in first aid now than we were 29 years ago when I joined. Although we were quite good then, we're even better now. If somebody's not fit to be in custody, they're taken to hospital first. That's the starting point. So if they're heavily under influence of a drug or alcohol, not in a position to stand and or talk, that becomes a health matter. But if they're accepted in custody and they're slightly under influence, we do observations on them. So it may be 15-minute observations, 30-minute observations, or 1 hour or whatever. Before we release them, they've got to be fit for release, which means they've got to be in a suitable condition that they're not going to be a risk to themselves or others before release. If they're going to court the next day, they will not be accepted if they're under influence at all. If the inmate makes self-harm or suicidal comments, they'll receive a fitness for assessment with a nurse, fitness for release with a nurse. So that's a major thing for us, is that we get the well-being of having a nurse within the custody centre to check on the well-being of that person. And we have staff from the Change, Grow, Live project, and they come in and visit people to offer support before they get released as well. So it's quite a comprehensive package, because I think a number of years ago we recognised we've got a captive audience there, the people that might want to, that might be the change for them. They might, so we can get the relevant professionals in. If I've got 4 officers at hospital for 4 hours, that's a significant amount of my team away, and that's 4 officers that can't be out doing other duties. So yes, it has an impact, but it's a necessary impact and we have to take it. What could improve the situation? A number of aspects. One would be that people don't get under influence of drugs to the excess that we need to go through the assessments. The second one, I think, would be if we had an uplift in resources within A&E and resources within the hospitals, that may help as well. But that's out with Police Scotland's remit. So I think that the important thing for me with this is we continue as it is, the care and welfare. But I don't want to go back to the old days where people were put in a cell and just the door was shut, and sometimes it was you opened the door 8 hours later. Thankfully every one of my prisoners was alive. We don't want to be in that situation again, because we're much more sighted on the care and welfare of prisoners, which is the right thing. So I'll start at custody. We have lots of posters within custody, and we already have the third sector going in and doing welfare visits, which is a starting point. My school link officers are doing presentations. My community team go into schools and do presentations. If we get calls about people involved in dealing drugs, they directly come to me. So intelligence disseminations come to me. My team will go to that area. We'll visit the houses, we'll visit the neighbours, we'll do callback cards promoting Crime Stoppers so people can report anonymously. We do door to door, we speak to members of the public and educate them that if there's stuff going on, you've got to let us know. A lot of people understandably don't want drug use or drug dealing on their doorstep. So it's an education thing there about how people can report things. But yes, well, let's not go away from it. We're the police and our job is to, report offenders to the Crown, the courts. That is our job. However, I'm mindful that we need to educate people in that. So that's what my community teams are doing when we're out doing community events. We've got lots of leaflets of this that I've already showed that we distribute so that people have a signpost to seeking help if they're wanting to seek the help. So I think other than social media, but I don't necessarily know that police are the right medium to be promoting addiction services potentially, but we can be partners with. I think it's most important that we are.